Children's health is important to me as a healthcare provider, as a parent, and as a member of our community here in Ottawa. We want to see children having a bright future.
As a pediatrician, I see the value of paying attention to their health and how it brings better outcomes.
They are vulnerable and dependent and full of opportunity, and we owe them health.
I think it's so crucial to invest our time and our energy and our resources in making sure that children are a healthier part of our community.
Healthy Canadian children today mean healthy Canadian adults tomorrow. So help us do better for our children.
Hello, and welcome to our virtual pop-up event titled Truth, Trust, and TikTok, How Disinformation and Digital Harm Threaten Children. We are excited to host an engaging discussion on the topic of online harms, legislation and regulation, and what role the child health community should play in this conversation. My name is Ryan Boyson, and I am the Director of Practice and Policy at Children's Healthcare Canada. I will be your host and facilitator for the next 90 minutes. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin and Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples. We are grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. Today's webinar will focus on the impacts of disinformation and digital harms on children, which are disproportionately felt by these communities. To kick things off, it is my privilege to introduce Emily Grunwald, the CEO of Children's Healthcare Canada.
Good morning, everyone. It's great to see so many faces online today, a sign of the relevance of the discussions that we're going to have. I'm really thrilled to be here to welcome you to this timely discussion, Truth, Trust, and TikTok, How Disinformation and Digital Harm Threaten Children's Health. Thank you for taking the time to join us today. Whether you're a clinician, a policymaker, a researcher, an educator, a parent, or you wear several of those hats, we're really grateful that you're here. We have an incredible group gathered today from across the country, united by a shared commitment to protecting children's health and well-being. As many of you know, Children's Healthcare Canada works alongside our members to ensure that Canada's health systems are not only purpose-built to meet the unique needs of kids, but are also prepared to respond to the challenges of a rapidly changing world. Very few challenges have emerged as quickly or as powerfully as the rise of health misinformation and digital harms, and their impact on children is measurable and it's significant. For young people, the internet is a powerful platform where they learn, where they connect, and where they establish their identities. But it's also where children and youth are increasingly exposed to harmful content, misleading and inaccurate information, predatory algorithms, and toxic norms that undermine their physical and mental well-being. As a sector and as champions for children, we can't afford to stand on the sidelines. Our role is to ensure that the children's healthcare community has a seat at the table and that our experience and expertise helps to shape meaningful change in this space. This virtual pop-up symposium is a space to consider questions like how do we meet kids where they are on platforms like TikTok, where safeguarding the integrity of the information they receive? What regulatory policy or advocacy tools are available for us? And how can we work together to ensure digital spaces are designed with children's rights and their needs in mind? I'm so pleased with the extraordinary panel of experts who will help us tackle these questions. But first, it's my great pleasure to introduce a colleague, a partner, and a sponsor of our work in this area, Dr. Joss Reimer, the past president of the Canadian Medical Association.
Good morning, I'm Dr. Joss Reimer, past president of the Canadian Medical Association, and I am so pleased to welcome you all to join this important discussion today. I really wish I could be there with you. This is such an impressive group of child health leaders, practitioners from across the country, child health decision makers, advocates, digital safety experts, educators, and engaged parents. And while this is a very diverse group, I know we all have something important in common, and that is that we have a deep sense of responsibility and care for the health of children and families living in Canada, and a desire to make sure the online environment is safe and trusted for everyone. At the CMA, we jumped on the opportunity to sponsor today's event because we share your concerns about the shifting landscape around health misinformation and the impact it's having on our health system, our friends, our families, but especially our kids. Kids need to be our top priority, and protecting our information environment should not be just a health issue. It's also a matter of national security, of democratic integrity. Our lives are colored by the information we consume daily. We can't let lies shape the way that we understand each other or the world around us. Protecting trust in online information, trust in physicians, trust in the health system is something the CMA takes very seriously, and we are determined to contribute solutions. Today's conversation is key to identifying what we can do collectively to protect the information environment for patients, for families, and providers alike. I was a medical officer of health in Winnipeg during the acute phase of COVID, and in fact, I was in charge of the vaccine rollout. So I experienced firsthand both the opportunities but also the challenges of supporting families in making informed decisions. And because I worked on the vaccine, trust me when I tell you that I saw how damaging misinformation can be to families who are just trying to make the best decisions that they can for their families. We are all now seeing the impact of what's happening in the US, which makes today's conversation all the more important and timely. At the CMA, we recognize the critical role that we can and must play to safeguard and enhance the integrity of health information. That's why we're mobilizing knowledge to understand shared challenges with our Health and Media Annual Tracking Survey. Reports like these can help us to better inform decision makers and inspire innovative solutions to these shared challenges. We're also building a community of health information sources for Canadians, sources they can trust. And we're doing this by investing in health journalism through a partnership with the Canadian Press and also working with the Canadian Journalism Foundation to support Indigenous-led health journalism. On top of that, we're supporting physician advocates who are present on social media so that they can be there to share reliable health information alongside all the misinformation that so easily propagates in social media. Youth in Canada are accessing media and information in new ways, and we are committed to reaching them where they are. Healthcare for Real is an online hub and social media initiative to share trusted health system information and solutions that speaks to the next generation. It's vital that trusted health voices meet people where they are, especially on social media platforms where children, youth, and families get their information, particularly when they're getting information about their health. There is still so much work to do, but we are committed to the fight. And what you are doing today, sharing information and insight about what's working and what's not here in Canada and around the world, is going to advance change that is critical to make sure we protect each other in this information environment. Our most complex problems deserve our curiosity, our conversation, and most of all, our action. And that's why I'm so inspired to see groups like you doing the work that you're doing. I wish you all a productive conversation today. And as you can see, I'm on the road, but I wish I could be there for you. And I look forward to learning from all of the discussions that you have. Can't wait to see what comes out of this day.
Thank you, both Emily and Joss, for grounding us today. We're at a pivotal moment in this conversation. Just this past week, new research sounded alarm on Sephora kids, children as young as 7, copying influencers' expensive skin care routines with products that can actually do physical harm, sort of promoted under the guise of self-care. Ever increasingly so since the pandemic, we've seen research and reporting on how health myths, spread rapidly across social media. These headlines highlight just how fast kids encounter these risky messages online and how unprepared the landscape is for their well-being. The algorithm you and I see as parents, as clinicians, researchers, policymakers even, is so fundamentally different than the social media feed of a child or youth in Canada. It is often difficult to explain the urgency of this matter as a result. The federal government may be interested in drafting rules, but without our input, these policies can easily miss the mark. I'm gonna highlight one of the things that Dr. Reimer said. Our most complex problems deserve our curiosity, our conversation, and most of all, our action. And that's exactly why we're here today, to bring our curiosity, spark conversation, and turn it into action. We are delighted to welcome a panel of experts to unpack this complex problem and discuss policy solutions that will make a difference for kids in Canada. I'll start with John Matheson. John Matheson is the Canada lead at Reset Tech, a global nonprofit dedicated to fighting digital threats to democracy. He also serves as Senior Fellow, Tech Policy at the Center for Media, Technology and Democracy at McGill University, a key partner in this work. As Chief of Staff to the Minister of Canadian Heritage, John oversaw the development of a trifecta of internet bills designed to bring out more accountability, transparency, and fairness to big tech's business practices: the Online Streaming Act, the Online News Act, and the Online Harms Act. Welcome, John. Dr. Tracy Vaillancourt is the Tier 1 Canada Research Chair in Youth Mental Health and Violence Prevention at the University of Ottawa, where she is cross-appointed as a full professor in counseling psychology, Faculty of Education, and the School of Psychology, Faculty of Social Sciences. Dr. Vaillancourt is also a member of the Brain and Mind Institute, Faculty of Medicine, and the Center of Health Law, Policy and Ethics, Faculty of Law at U of Ottawa. She's the past president of the International Society for Research on Aggression, a fellow on the Royal Society of Canada, the chair of the Royal Society Canada COVID-19 Canada Learning Loss Working Group, and the chief editor, Frontiers in Child and Adolescent Psychiatry, Child Mental Health and Interventions. She is also a senior fellow with the Center for International Governance and Innovation, and an advocacy board member for the advisory board member for the Canadian Pediatric Society's Center for Healthy Screen Use. Thank you for joining us, Tracy. Marie-Ève Nadeau is head of international affairs at the Five Rights Foundation, leading global efforts to put rights at the heart of digital policy. Children's rights, that is. With a background in international law and human rights, she is a dedicated advocate for AI governance, data protection, and online safety to be designed with children in mind. Based in Brussels, she has shaped policies and strengthened the global frameworks holding companies and governments to account in the EU, the African Union, and 15 countries from Indonesia to Argentina. Marie-Ève, we're catching you at the end of the day, so I appreciate you making the time. Lastly, a dedicated advocate and leader, Mahir Rao, pushes for environmental protection, social justice, and well-being, and youth engagement in decision-making. He served UNICEF Canada as a national youth advocate, advancing dialogue and action on youth advocacy, climate, and civic engagement across numerous platforms. Through his leadership of the Canadian Rockies Youth Network, Mahir facilitates year-round educational events for a province-wide network of youth, and has met with government representatives, stakeholders, and policymakers to push for youth representation in environmental policies. He has also collaborated with Parks Canada to provide youth consultation on land management area plans in the Canadian Rockies. A strategic and collaborative thinker, Mahir is deeply committed to securing meaningful youth representation in design and decision-making, ensuring his impact will be felt for years to come. In his personal time, Mahir enjoys channeling his creativity through the performing arts and embarking on various culinary adventures. He has a knack for geography and can explore maps for hours on end. As he pursues international relations, he blends deep in his advocacy efforts, connecting global policy and local action. Welcome, Mahir. Okay, thank you all and welcome all. I really appreciate you taking the time out of your work and school days to be here. It is now my pleasure to pass the mic to our first speaker, John Matheson.
Hi, everybody. Thanks, Ryan, for that introduction. I thought today it would be just a good idea to start with a bit of a status on the legislation that was put forward in the previous Parliament, the Online Harms Act. We've been having this conversation in Canada for a number of years, and the way we got to where we are today is it all started in 2019 with a white paper. That white paper then turned into an online consultation with drafting instructions on a new piece of legislation designed to protect people from all types of online harm. That consultation was met with near unanimous criticism from Canadians, because it opted for what we call a content moderation approach, meaning that when there was problematic content detected on a social media platform, it would have to be taken down. Now, you can imagine that resulted in criticism from civil society groups in particular, who are concerned about freedom of speech. So there were censorship risks there. That resulted in 3 years of extensive consultation. The government went back to the drawing board. They had a Canadian Commission on Democratic Expression. They had 3 citizens' assemblies with Canadians from all walks of life. They had an expert advisory group on online safety, and 19 ministerial roundtables across the country, including a youth assembly on digital rights. So that resulted in Bill C-63, the Online Harms Act, which was introduced in the previous Parliament, last February, in fact. Unfortunately, when former Prime Minister Trudeau prorogued Parliament in January of this year, the bill died on the order paper, as we say. Now, that's not to say that the bill, even after 3 years of consultation, was perfect. There were problems with the bill, which I'm happy to talk about if of interest. But I think the pertinent point here is that the Carney Liberals picked up on some of the Trudeau government's unmet promises, and Prime Minister Carney, in his electoral platform, said that they would introduce legislation to protect children from horrific crimes, including online sexploitation and extortion. So at this point, it's not clear which minister would lead that legislation, but we are concerned that the Carney government is viewing this file more narrowly through a criminal justice lens. And this would be a mistake, because the platforms, as I'm sure you all know, are totally unregulated in this country, and they need to be held accountable. And the way to enforce that accountability is through a new regulator. And we could really use your collective help in making that case to the new government. One thing we've done in the past year or so is we've reset the narrative really to focus on children's health and well-being. So Reset Tech, along with some of our partners who are here today, like Five Rights, Children's Healthcare Canada, the Canadian Medical Association, Canadian Centre for Child Protection, and the Waltons Trust, have tried to assemble a broad-based coalition of stakeholders to urgently advocate for this legislation. We've had some modest success to date. We put forward a letter signed by 30 organizations last fall, which resulted in parliamentarians moving the bill to the committee stage, even though nothing was moving in the House of Commons at the time. We did a similar letter this past election cycle, which we hope contributed to the Liberals' platform commitment, which I just outlined. And we've got thousands of grassroots Canadians demanding action. There's a campaign out there now called Safer Online Spaces, which we and Waltons and our other partners I mentioned are supporting. And across party lines, Canadians want an internet that protects children. And it's important, if we just step back, as to remember why we're doing this. And in all of our interactions with the government, we try to remind them that Canada ranks 31st out of 38 in the OECD for youth well-being. 1/5 of Canadian youth aged 12 to 17 report negative mental health effects related to their online activity. And significantly contributing to this low ranking is the AI-generated content, algorithmic recommendation systems, and totally unregulated platform design that expose people, young people in particular, to harmful content, including content that encourages violence, self-harm, and exploitation. And this is being done, of course, at an unprecedented scale. Cyberbullying, grooming, addictive design features are not isolated problems, but these are symptoms of really a broader market failure, which is that the platforms have no meaningful incentive to prioritize child safety. Their business model is based on keeping people's eyeballs on the platforms so that they can earn greater ad revenue. So these unambiguous and I would say unmitigated risks to young people represent a clear market failure. And that's the way we've been trying to position this with the new Carney government. And other democracies, frankly, have shown that they can address this in a way that upholds the freedom of expression of all of its citizens. And we really think it's time for Canada to catch up. So what are the core elements of new legislation? We think broadly 5 pieces. So number one, there has to be a duty to act responsibly, a duty of care. So the platforms must assess and mitigate risks of serious types of harm to prevent them from appearing in the first place. It's akin to what we did in the latter half of the 20th century with automobiles. First, they didn't have seatbelts. Well, that posed health risks, so we added seatbelts. We're saying that the platforms have to design their services in a way that limits and mitigates the risks to children. That's the duty to act responsibly. There also needs to be measures around transparency and accountability. So this would include, for example, mandatory algorithmic impact assessments, public reporting, and independent audits. That would be enforced by the third element here, an independent regulator. So the previous government had called it a Digital Safety Commission, pretty agnostic on the name here, but basically it needs to be arm's length from government, and it needs to have strong enforcement powers with technical expertise. And that would require a new regulator that does not currently exist in the government. Finally, number 4, and probably most importantly for this group, youth protections, specific youth protections. Age-appropriate design standards, which have been very successful in the UK, California, and other places. Opt-out rights from algorithmic feeds. Prohibition on data collection of young people. Restrictions on advertising to young people. Content safeguards that are targeted to youth. And obviously, restrictions on the proliferation of unfettered AI-generated content. And all of this would be made more transparent and accountable in a sense to the public through better data access for public interest research, like many of the research, like the research many of you do. So I think those are the key elements of what new legislation could look like. We could also talk about, some of the consumer safety standards that were in the failed AI bill of the previous parliament. There's been talk about a youth rights ombudsman, and there's been, I think, increasing agreement in civil society that we need to include new types of harm, like financial scams, even though these are less relevant to young people. I think financial scams are a serious type of harm that could be included in such legislation. And AI chatbots, which I'm sure you're all familiar, pose significant risks to kids. So I think that's an overview. Ryan, I don't know if you have any follow-up questions.
No, John, I think that's a great great context for us to start with, and I'll probably hold off my question until the Q&A period.
Sounds good.
Awesome. Yeah, the next step, I'm going to pass the mic over to Mihir Rao to give us the youth perspective. Mihir, I'll just highlight for you and the other speakers, looking at the questions that we asked, the impacts of digital harms and disinformation showing up in day-to-day work. I think looks like close to 90%, 85% said, yeah, it's showing up in our work. And talking about if they're knowledgeable on it, I would say that's where we saw, most people right in the middle, sort of a 3 out of 5. And then do they feel equipped? I think less than two people said they strongly agree that they feel equipped. So pretty good group here with us today. But yeah, excited to hand it over to you to sort of hear the youth perspective on this issue.
For sure. Thank you so much, Ryan. And thank you, John, for framing our discussion and talking a little bit about the policies and actions that are being done in the space to combat digital harm and misinformation. I'd like to begin with a quote from a journalist that powerfully captures today's theme. In ancient times, poisoning the well was how you destroyed a community. Today, poisoning the story is how one destroys a community. So we can see this message everywhere across the globe, even down south. which is that misinformation takes many forms through propaganda, bias, and online harm. Basically, the stories we consume today are curated less for accuracy and more for virality. And that poses a really, really big risk and danger to our tolerance, empathy, collaboration, our citizenship, and most importantly, our health and the health of our community. So, to frame our discussion, I'd like to make a distinction between misinformation, which is false or inaccurate information spread without intent to deceive, usually due to misunderstanding, while disinformation is deliberately false information, which is created and spread with the intent to mislead, manipulate, or deceive. So that can take the form of government propaganda, of AI chatbots, pushing a specific narrative online. So it takes many forms in our day to day lives. Our communities thrive on trust and mutual respect, but misinformation and disinformation erode these foundations. They create sort of false truths, misunderstandings, conflict, biases. So that misinformation is the poison in our well. That misinformation and disinformation pushes a singular, one dimensional narrative that many people my age, I know, adopt. They operate through a singular perspective on many issues and tend to not see or turn a blind eye unintentionally to many of the diverse perspectives on surrounding these issues. So that is why it is so important to combat this digital harm and to combat these narratives that are being pushed around so often on social media. Our disinformation spreads rapidly through social media algorithms, influencers, bots, as John was talking about, even gaming platforms. So these mechanisms exploit the attention of youth. Youth are the main users of these online spaces, and they spread lies faster than the truth can reach them, especially on platforms that are designed to spark outrage, to emotionally provoke, to get a reaction out of their audiences. That's how many of these platforms make profit, right? Through reaction. So that's how they're designed. And as youth, we are prime targets of those designed structures. We are among the most connected generations, but also the most vulnerable due to limited digital literacy, as this digital world and advancements are happening so fast. It's very hard to keep up with it all. So that is why digital literacy that evolves with the world is extremely important to help youth, people my age, to help even adults, even older, like senior citizens, develop these critical thinking skills and learn to navigate this new world we live in. We don't have to look far. We have these narratives in climate change denial, mental health disinformation, health disinformation. You know, sometimes people think Google is your doctor. Google is not your doctor, right? So disinformation, misinformation can take many forms. And speaking to disinformation, which is the deliberate manipulation of information, that is a weaponized narrative that can shape how kids my age can see the world, can look at their own bodies, look at their future, and it sparks comparison, anxiety, insecurity. Even misinformation does the same. It's that balance, what is intentional, what isn't, but both have harmful effects. So now I'd like to talk on the health impacts of those digital harms. First off, the mental health effects are staggering. Constant exposure to toxic or false content increases, as I said, anxiety, depression, low self esteem, especially among teenagers who are still in their formative developing years. Disinformation about nutrition, fitness, medical treatments, often due to a desire for profit from many companies or products. They result in dangerous physical and mental behaviors, such as disordered eating. There's also social harm. Disinformation and misinformation isolate youth from peers, polarize communities, radicalizes some into harmful ideologies. There's really no control to what goes on on the internet because it's such a vast space. You don't even know the true breadth of it. That's why control and proper policy regulation is so critical in our country and in the world. According to research from the World Health Organization and the United Nations, pardon me, Emergency Trust Fund, UNICEF, online exposure has a growing correlation with rising mental health struggles, especially in adolescents, people my age. Now, I'd like to talk about how children's rights specifically are being impacted by these digital harms, how they're being violated online. Under the UNCRC, the United Nations Convention on the Rights of the Child, Article 24 details the right to health, and harmful content online jeopardizes youth mental health and physical well-being. Article 17 speaks on the right to be informed. Youth have the right to reliable, accurate information, and platforms must uphold that. And we as citizens, we as a community, national, local, we all have a duty to hold them accountable, to hold our leaders accountable, to keep these platforms accountable, to keep our spaces safe for people to use. Article 19 details the right to protection. States and platforms are responsible for protecting youth and their users from harmful, violent, and misleading content. We don't see that protection upholded often. Article 12 is the right to participation. Youth must be included in policymaking about tech, not just consulted, but partnered with. So this speaks more to the solutions we take to approach these issues. In these solutions, youth being in their formative years, and also this Generation Z being the main primary users of many of our digital platforms, be it Instagram, Snapchat, or TikTok, we need to be partnered with to address what concerns impact us and how we can move together forward collaboratively and really combat these harmful digital harms. So, as I said, we are digital natives. Our generation, the internet is our classroom. We have grown up with it, and now it's being increasingly prevalent in our lives. It's our entertainment, social scene. It's everywhere. Studies show that youth spend 7 to 9 hours per day online, making us not only the largest, but also the most vulnerable demographic of digital users. According to UNICEF Canada's U Report, 56% of U reporters rely on social media for news and information. That's over 50%. And that is the main source where they get to know about what's happening around them, what's happening in their world. 63% are worried about misinformation, disinformation. 39% say intentional lies are more dangerous than misinformation. And 36% trust NGOs as the most accurate and credible sources. So now the root of the problem is the lack of critical thinking. Governance of digital structures is one thing, but it's also the critical thinking. I see this every day, even in my peer groups, whether it's political news, global affairs, current affairs, social movements. I know many of my peers absorb information passively and bringing in their own preconceptions without fact checking. They adopt the first opinion they hear, especially if it's emotionally resonant or socially reinforced by many people. That's that herd mentality. If many people believe it, people just hop on that bandwagon, right? The reason I'm saying this is parents, practitioners, please encourage these skills among your children, among anyone you work with. Because we live in the age of information, but what many of us lack is the ability to process that information critically. We must take it upon ourselves to educate ourselves, to seek out multiple perspectives and not believe the first thing we see. Read across different ideologies and parties. If someone doesn't agree with you, listen to them, hear them out, and then form your opinion. Do not adopt that singular perspective after hearing what your family said or what your coworker said. Because the truth is, in our world, knowledge is transient, it's subjective, it's based on the people around us, and we need to start combating that by seeking out multiple diverse sources and perspectives. As I mentioned previously, digital harms are about design. Social media apps are engineered to keep you hooked, flooding your brain with dopamine. That's the feel-good chemical that keeps people scrolling And it has reduced our attention span drastically, and it also has reduced our ability to think critically and address a topic from multiple standpoints. So before reacting to something online, before believing something online, ask, where is this coming from? Who benefits from my reaction? Because as I said, many of these platforms provoke a reaction that benefits them. So now into solutions and what youth and children need with regard to digital harm. We cannot fix this by just telling people what's true. We fix it by empowering youth to think critically in their lives and also properly governing the digital structures and designs that shape our information today. So that means equipping youth with media and digital literacy, whether that be implementing through curricula in schools and education, teaching them to seek reputable, nuanced sources, as I mentioned, and encouraging them to develop their own views, not inherit someone else's. And I speak on youth because they're the most vulnerable, but these recommendations, these urges apply to everyone across the community, every age range, every demographic. These skills are essential for everyone because we all together live in this age of information. Speaking back on youth, we are aware. Globally, we make up over 1.3 billion people. We are aware, we are engaged, we care about what our leaders say, what our practitioners say, what our adult allies say. We react, we consume, we respond. We are very opinionated in that way, and that is why we are so deeply affected by decisions made about our digital spaces, because that is where we share opinions, that is where we get our opinions. So when speaking to governance, when speaking to properly controlling and regulating these designs and holding leaders and platforms accountable, solutions shouldn't just be youth advised, they must be youth co-created with youth. Thank you.
Thank you, Mahir. Your authenticity, charisma are undeniable. I really appreciate you bringing that perspective in. Next up, we have Dr. Tracy Vaillancourt to unpack some of the research and evidence coming to light on this topic.
It's a perfect segue to my talk. I thought that was just so fantastic. I could hear him speak all day. So I was asked to talk about the Canadian context, and I'm going to get a little bit into the data, but I'm going to have slides to support it. I'm going to mention a study that I'm the PI of that's also working in partnership with our lovely hosts today, Children's Healthcare Canada. So I'm leading the Ontario Health and Peer Relations Study that's funded through the Canada First grant. And this is important because this is where the data for the Canadian context is. So I just want us to understand the design of the study first, and then I'm actually going to provide very timely data on how young people in Canada, Ontario, are managing the internet or digital their digital devices. So this is a longitudinal study where we collected data last year at the end, right at this time, from about almost 13,000 children in grades 4 to grade 12. Then we repiloted our survey. Now we're data collecting on over 200,000 Ontario students, again in grades 4 to grade 12, and we're going to be following them using an accelerated longitudinal design for the next 7 years. So we have funding to follow them up, and we have tons of school boards involved. This is a really innovative design, I believe. We're able to link it back to Stats Canada data. We have the design where the student is in the middle and always center to our decision making. We're assessing them on a variety of different things. I'll show you in a second what we're looking at, but just know that students are nested within schools, which are nested within communities, which are nested within our province. So it allows us to look at different things that happen within at the school level, at the individual level, at the community level. So really nice way to affect change. We measure almost everything and anything, but obviously related to health. So today I'm not going to focus on all of these areas. I'm just going to focus on sleep and mental health vis-a-vis screen time and in particular social media dependency. We have some really key questions. One of the ones I was really interested in, and we have data to look at this on 12,000 kids, is does the Ontario Ministry of Education's new cell phone policy improve students' mental health and reduce bullying? There's a lot of data coming from around the world suggesting it does work for some, it doesn't work for others. Well, what's happening in Ontario? Is this the way to go? We're also interested in things like which health and behavioral factors best predict school attendance rate. School attendance is terrible these days. It's been terrible since the pandemic. We need to get kids back in school and learning. We're really interested also in knowing if they know where to access help, if they're feeling stressed out, and other things. So we have, for example, a grade 7, grade 8 universal school-based mental health curriculum. Is it working? So that's basically the design. We specifically looked at digital device dependency, which is a little bit different from how others have done it. I'm trained as a child clinical psychologist, so I'm really interested in, can they get it out of their hands? What happens if they're not on it? Are they anxious? That sort of thing, which is a little bit different just from the number of hours they spend on the platforms. So again, the pilot data that I'm going to be presenting gives you a snapshot of what's happening. I can't imagine that this would not be true of kids across Canada. So this is a representative sample of Ontario students, close to 13,000. The data on dependency is from students in grades 6 to 12, and then I have also just use. So here is what's happening with Ontario kids. And again, I think it would apply to Canadian kids. So 62% brought a mobile phone to school. So this was before the ban, before the Ministry of Education put in its restrictions. So this was data collected last year, but I'm going to give you a little bit of data from this year too. So 62% brought a mobile phone to school, and that was 97% of students in grades 9 to 12. 67% thought about their mobile phone when not using it in class, and that's 81% for high school students. 66% use their mobile phone for no particular reason at school. That's 88% for high school students. 49% stopped whatever they were doing because of a notification at school, and 70% of high school students said that they did this. 47% of children in grades 6 to 12 said that they were anxious or distressed by the idea of not having their phone, and this rose to 63% for high school students. 65% access social media platforms at school, and this was true for 85% of high school students. So you can see that they're using their phones, they're dependent on it, they're meeting a lot of what we would look at in terms of dependency behavior and thoughts. We also looked at whether or not they were looking at using their electronic device in their bed before falling asleep, which is not really good. 72% said in grades 4 to grade 12 said that they had used their electronic device before falling asleep. 59% in grades 4 to 6, 78% in grades 7 to 8, and 89% in grades 9 to 12. The problem with this is that we also find a relationship between students who use their electronic device in bed and not attending school because they were too fatigued. So 10% of elementary school students told us this, 14% of middle schoolers, and 20% of high school students are not coming to school because they were too tired, and they're also on their devices at night. We see that this was a stronger association for girls and for younger teens. And there's tons of evidence coming out that so this is a recent study published in JAMA from 2024, and they're looking at screen time and impaired sleep. A new paper just came out, new study on over 3,000 kids looking at the neurocorrelates of impaired sleep. It's really not good for attention. It's not really good for mental health. It's not good for academic performance and the like. We also found that if you had mobile device dependency, it was correlated with emotional problems, and that this association was stronger for girls than for boys. And this largely replicates what we see in meta-analyses. So one of the things is that most of the meta-analyses coming out are showing an association between emotional problems and however you're going to define mobile device dependency or use or social media apps. Anytime they're looking at these things, they're finding in a small effect size. And, this is leveraged by certain groups thinking this isn't anything to worry about. I'll get to that in a second. But one of the problems with past meta-analyses is that the data going into them are not very good. So now we're getting new studies coming out. This one was just published in JAMA, looking at social media use and depressive symptoms during early adolescence. And they used the best way of measuring this, a longitudinal design with a cross-lag panel model, where you can differentiate between within person effects and between person effects. So you really want to be looking at my use vis-a-vis my use and my mental health vis-a-vis my mental health in the prediction of cross-lag panels or cross-lag associations. And this is telling us that it's not depression symptoms that are driving social media use, it's social media use that's leading to increases in depressive symptoms over time. But is this all moral panic? Again, the effect sizes are pretty small. So people are saying that this is nothing to worry about. There's many things in the equation. There's many reasons why kids aren't doing well. We're seeing headlines like this. This was in the Atlantic not too long ago. The panic over smartphones doesn't help teens. This one just came out the other day. Stop panicking over teens and social media. And I'm saying that we should panic. So, there's the whole group, there's a group that's saying that there's nothing to worry about, but there's more of us saying that we need to worry about it. And the reason I think we need to worry about is because we have more than 5 billion users. Because 95% of teenagers between the ages of 13 to 17 use social media. Because 40% of 8 to 12-year-olds use social media. Because 50% of that 95% of teens use it almost constantly. They're using TikTok, Instagram, Snapchat, and the like. And it's interesting, there's this gender difference. Girls are saying that they're more likely than boys to use TikTok almost constantly, and the reverse is true. So anytime you have the whole population implicated, our ability to deal with small effect sizes is really not tenable. It's really hard to keep up with this. And this is one thing I argued during the pandemic. When we closed schools, the effects of school closures on mental health were small effect sizes at the beginning. But my worry was 1.9 billion youth were implicated. So every kid in Canada pretty much is implicated in this topic. We have 30% of 5 to 7-year-olds who are on TikTok. This isn't good. So I argued during the pandemic, our group argued that we really should be thinking about population risk in terms of absolute rather than relative terms, because the whole population is implicated. And when the whole population is implicated, small effect sizes really matter. So we need a course correction. So we wrote a paper, Samantha Bradshaw and I looked at this vis-a-vis the developing teen brain. We came up with 3 potential areas to think about. One was the need for better data on the effects of youth. So a lot of the early meta-analyses do not have good data. The best data are longitudinal designs that separate between and within person effects. We need child protection legislation, and it should focus on the addictive features. And we need education, which is what we just heard from our young speaker, Mahir, when he talked about critical thinking skills. In terms of better data, we have better data. The problem is we're still collecting it. So most schools are out on Friday. We're literally collecting data right up until Friday. So we will have data on over 200,000 students in grades 4 to 12. We also have data on 12,000 students before and after the Ontario Ministry Education cell phone policy. So we'll be able to say in Ontario if this policy worked. So I have data here I'm going to present. It roughly represents about close to 100,000 kids in Ontario. So it's not all the data, it's preliminary, but I want you to see this is after we have a so-called ban on cell phone use. So we asked, how often do you think about your mobile phone when you're at school? And we see that only 18% never think about their phone. We asked them, if they would be feeling anxious or distressed without their mobile phone, and 50% of the population said, yes, this makes them feel anxious or distressed. So that's the Canadian context, not looking good. And if anybody wants more information, I'm happy to hear from you.
Thank you, Dr. Viancor. I appreciate the timely data to inform our discussion today. Before I pass the mic to our final speaker, if you do have any questions for any of our speakers, please use the built-in Zoom Q&A function. The Children's Healthcare Canada team will be sorting through those in the back end. Okay, Marie-Ève will now talk about policy approaches that can be leveraged on this issue, sort of from the global perspective, and hopefully give us some inspiration related to how Canada can move forward on this issue as we move into the Q&A.
Thank you so much, Ryan. Bonjour tout le monde. Bon après-midi. As a fellow Canadian now based in Brussels, that's such a great pleasure to be even virtually back in Canada and to share some of our work and experience in this space. As Ryan mentioned, at Five Rights, we are working globally for more than a decade on children's rights in the digital environment. And as the last speaker, I'll have the honor and the pleasure of echoing a number of points that were raised by my fellow panelists about our work, the international landscape, from the risks to the way forward, hopefully bringing things back. So building on what Tracy, Mihir, and John mentioned, I'd like to take a step back on the risks in the digital environment. Over the past decade, there has been growing understanding of children's experience in the digital environment. And it's been very clear that the risks children face are not just about the content they see, but also about who they're interacting with, how they are pushed to behave, and how their presence is exploited commercially, as it was highlighted by John and Mihir. And this has been recognized internationally for more than a decade under the 4C framework, covering the content, the contact, the conduct, and the commercial and contractual risks on top of the cross-cutting ones. And our research, Disrupted Childhood and Pathways, has shown how those risks are further amplified by how platforms are designed to prioritize profits and business objectives, as it was highlighted earlier. So platforms are designed to capture attention, to maximize screen time, to generate engagement. And among these practices, persuasive design, dark patterns to extend use, incessant notification, endless scrolls, random rewards, ranking systems, likes, shares, quantification of popularity, and the massive exploitation of personal data that further optimize engagement and monetization. And we've just heard it from Tracy, but those choices come at a high cost for children. They exploit their psychological triggers, their emotional vulnerabilities, anxiety. They reinforce insecurity, the fear of missing out, and the need for validation. And as Tracy mentioned, the addictive interfaces disrupt sleep, play, and learning. And it transformed the digital environment into states of permanent and invisible manipulation in ways that children cannot understand or meaningfully resist. And now with artificial intelligence, AI systems are turbocharging those risks at speed and scale. And these also weaken the information ecosystems, as it was raised. They amplify the most extreme content because that's what generates the most clicks, the most reactions, and the most engagement and profits. And as whistleblowers Frances Haugen and Arturo Bejar have laid bare, companies know the harm their systems cause to children, and they continue regardless because they treat children just as collateral damage in the pursuit of profit at all costs. And this exposed the absence of meaningful constraints on the tech sectors and a profound failure to put the rights and well-being of children above commercial interests. And I'm happy Mir mentioned children's rights because children are rights holder under the Convention on the Rights of the Child, which is the most ratified human rights treaty in history by all 193 UN member states besides the US. And international law is clear. States have obligations and companies have also responsibilities to uphold children's rights, including their rights to privacy, to safety, to education, to freedom of expression, and protection from exploitation, which in this case is heavily commercial exploitation. And these rights do not end at the edge of the screen. And General Comment 25 have set out how the convention applies fully in the digital world. And around the world, we are seeing now the recognition that children's rights must be embedded into digital system from the start. And countries are now moving from a react and patch approach to one of prevention by design, building on decades of work in that space. And on that, privacy by design that was pioneering by Canadian Anne Cavoukian, and safety by design. And these are no longer only aspirational ideals, but are becoming international standards. So there is a growing number of regulatory frameworks that is reflecting this shift. Here, it's only a limited sample, but so they include the age-appropriate design code that John mentioned earlier, that was replicated across the EU, in the US, all the way to Indonesia, and the EU Digital Services Act, the Artificial Intelligence Act, and most recent development as well on the African Union continent. And what they have in common is that they are grounded in children's rights and the Convention on the Rights of the Child, and stress the importance of putting children's rights, their best interest, at the core of digital design. In terms of scope, they apply to all products and services that is likely to be accessed by children, not just social media. And they require platforms to assess and mitigate the risks upfront, ex ante, including the 4 Cs: the contact, the content, the conduct, and the commercial risks. And they put the responsibilities on companies to provide age-appropriate experience and design system to be safe and privacy respecting by default. And when we see the gaps in a number of approaches, they are often gaps because risks to children are left unmitigated because of exceptions, because of loopholes, because of narrow applications, and reliance on patch up and quick fix rather than placing the responsibility where it belongs. And I'll be happy to come back a little bit more on those gaps in the discussion period. And now coming back on the age-appropriate design code, it has been in place since 2021, and we have seen that it's been possible to design digital service with children in mind. And here we see the number of changes that companies have announced following the code entry into force, with a marked increase when the code entered into force. And this proves that when regulation is clear and it is in force, then companies can respond. And I think Canada has now a historic opportunity to build on those global standards to confront the root causes of online harms. I think it's been resonating through our previous panelists as well: the unsafe design, the exploitative data practices, and the unchecked commercial incentives. And the path forward is clear, and so are the principles that must guide it. Thank you.
Thank you, Marie-Ève. I see questions have started to come in from the audience. Children's Healthcare Canada team is busy behind the scenes to get them sorted. If you have not had a chance yet to get your question in, sort of now is the time. I'll ask our all of our speakers to turn their cameras on. Thank you. I'm going to start with the not really a question, but more of a statement. And Marie-Ève, I wonder if you have sort of thoughts on this. As a parent of a child in high school, just completed grade 11, I feel the cell phone ban policy could not be implemented as planned, and cell phone use in classrooms actually continued as it was too difficult for teachers to enforce this. You know, there were attempts, but it was not as effective as hoped. I'm curious if you could kind of speak to sort of the effectiveness of bans, both on cell phones and I guess on social media in general.
Thank you so much. That is a very good question. And of course, I think the bans, maybe more broadly, are really showing the urgency and the need to do something about it. Especially in schools, I think we are seeing how much the teachers, the educators are struggling with and how much they are competing with. They're competing on systems that have been designed to maintain attention. So they are really they are really struggling. And we wrote specifically a piece on specific bans in school. But what I want to say specifically on this responsibility that it plays on teacher, especially to enforce the ban, I would say that at the end of the day, it doesn't necessarily make the platforms better for the children to be on them, but it places the responsibilities on teachers to enforce them. Of course, school is a place of learning and children have rights to education. But also, I think we have me here on the screen, and maybe we can ask him what he thinks about the approaches on the ban, because when we've been talking with our group of young ambassadors, they're often saying how there could be alternatives to bans and what good can look like. So I'm also curious to hear maybe about Mir's view on that.
Yeah, and I'll follow up there. There's a sort of a related question for and Mahir, if you want to jump in first, feel free. Many of us know that the harmful impact of online use and social media. However, attempts to reduce use among youth are often met with rage, is the word that this person used. Any suggestions for sort of navigating this, as limits are set? And I see Mahir had to step away for a moment. Any thoughts on sort of, yeah,
I'm going to
rage is a
jump
strong
in.
word.
I'm going
Yeah,
to
for
jump in
sure.
just because we're formally assessing this in Ontario. So I'm very familiar with the literature on school bans. They don't call them that per se, but so the social media policy or the cell phone policy for the Ministry of Education. I don't think that they're working the way they were intended to work in Ontario. Our preliminary data suggests that that's not the case. I think it's really hard to enforce, but this is the importance of having data to then inform the ministry about what works and what doesn't work so that that could be tweaked. In principle, I like the idea of limiting cell phone use and social media access during school hours. I want them paying attention to their lessons, not on being on Snapchat. I think they do a lot of social comparisons and a lot of unnecessary monitoring of the social landscape and the politics of the playground with their phones. So I'd like that out of the classroom. The data are mixed on what countries have done and what jurisdictions have put in bans. So, for example, in Norway, it looks pretty successful. Another study was just published in the Lancet. It wasn't a great study per se. They looked at bans in the UK. It didn't seem to work, but again, I had some issues with the design of the study. So all that said, I think we're going to get there. I think in principle, I agree with it, but just making sure we can get the little parts of it right so that teachers have a lot of support in managing this, that parents are on board and helping them achieve their goal, and that we recognize that class time should be focused on paying attention to the lesson. So that's where I stand on this.
Yeah, thanks, Tracy. Mihir, did you want to comment on this?
Sorry, I did cut out a bit. Could you repeat the prompt?
For sure. Yeah, so part of it was talking about sort of as a parent of a child in high school, the cell phone ban in their school really couldn't be fully enforced. There were attempts, but it was not as effective as hoped. And the follow-up question was sort of many of us know the harmful impact of online use and social media. However, attempts to reduce use among youth are often met with rage. So, any suggestions in sort of navigating that as limits are set?
Yes, for sure. I can speak to my own experience in my high school. The cell phone ban was implemented in my final year of high school, and it started off with teachers enforcing it, but it really wasn't effective, as Marie and Tracy were speaking on. And I think that's just because our worlds and our access to everything revolves so heavily around technology. It's so hard to get rid of. and it's hard to regulate it in that aspect, like limiting technology usage. And what happens if a student violates those policies implemented by the school board or jurisdiction? A school does not have full authority to take away the property of a student, so it gets very misconstrued. Like what can school boards do? What can educators do in these issues? I really think it's just evolving and growing with our times, understanding that technology will be an inevitable aspect, because we see these bans are not working, they're not effective. So really, how to navigate, how to use technology for the best. How can we limit the bad adverse effects of these platforms? How can we incorporate technology into education? How can we make lessons and curricula engaging, so students don't resort to this? But this is all holistic. Ultimately, there will be bad adverse effects of technology. That's not something teachers can fix. While like a ban is a is an effective response to it, is a justified response to these issues. But as we can see, it's not effective, and I can't speak on what would be effective at this moment.
No, appreciate him here. So talked a little bit about the sort of cell phone use in schools. The next question may be for you, Tracy. How does the youth data compare to adult data in terms of use? Discomfort with not having the phone? Are kids learning these behaviors from their parents?
I think we all have an addiction. I think we all have a problem with it. We need to own it. So I think they would really mirror what's happening in the adult world. The difference is that the way the algorithms are set up for attention economics, it really leverages the distinct properties of the teenage brain. I think that the teenage brain makes them particularly vulnerable to staying online longer, to getting hooked. It also, changes their brain. There's some evidence suggesting that there's some differences in the way the prefrontal cortex is mapping and the like. So I think that the vulnerability is a little bit different for adults and for children, but our use pattern is quite similar, but with children and youth being more vulnerable to actually really getting stuck. Because again, they have underdeveloped prefrontal cortex and underdeveloped nucleus accumbens, and that's a recipe for disaster when you're looking at addictive features.
Yeah, thank you. Okay, so we've talked a little bit about the role of schools, parents. There's a question here about sort of the for the practitioners out there. As a professional that works one-on-one with kids, does anyone from the panel have any recommended educational resources to use as a handout for these kids in sessions, focusing on teaching online critical thinking maybe, or any community-facing websites for parents to learn more as well?
From our side, I shared the answer to the response. I responded to the answer to the question, sharing our example of Twisted Toys. It really shows about like the commercial aspect of it that Tracy was mentioning, and I think it's really good to open the eyes on the problem. It's short video clip to talk about it. So maybe if you want to have a look at Twisted Toys, that's one of the resources we like to use. And I had quite a limited time because we also like to show that one also in presentations.
Yeah.
I could also hop in just for general practices to increase these critical thinking skills. Look at social media, look at your feeds, and once you discern what is fake, go to your children and ask them to, identify what's real, what isn't, and just practice that. Like you can see that through AI. AI is heavily prevalent in your feeds now, creating false content. Another resource I do have in mind, which I will post in chat, the European Union created an interactive game on misinformation and disinformation, and just talking about like the emotional, how people use emotional wording, how people attack one another, how people like silence perspectives to get one's point across, these different techniques for misinformation and disinformation in our world. So I can hand that over, and we'll paste the link in that chat too. It's by the European Union. They've developed that platform recently.
Awesome. Okay, so we've talked about the role, schools, parents, even practitioners. Maybe shifting to the role of government. Maybe John, I'll bring you in on. Are there any lessons that we've sort of learned from the Online Harms Act legislation from the previous legislative session, and sort of where we can go from here?
Yes, there are many lessons. Let me try to summarize them in a way that's useful for this group. I think that the most important lesson is that in order to achieve landmark legislation like Europe and the UK have done to bring more accountability and transparency to big tech's business practices, we as Canadians have to see this not as a partisan issue, not as an issue where different aspects or groups within civil society are advocating for their component, whether it's privacy, whether it's access to research or data, which I mentioned earlier. The most important thing is that we all have to sing from the same hymn book. And that's the way we will get the legislation through Parliament. If you look at the data, 69% of Canadians, according to a recent survey by the DAIS at Toronto Metropolitan University, believe that the government should intervene to regulate social media companies. However, the big tech lobby is very good at exploiting differences and raising, frankly, fear-mongering, like they did with anti-hate groups, for example, racialized groups, when we were contemplating the design of the legislation, suggesting that the regulator will be able to weaponize their powers against certain groups over others, and that was all nonsense. So it's very important that we are united in what we're asking for, and what we're asking for from the government goes back to those 5 elements of the accountability legislation. I really appreciate what Dr. Vaillancourt said about cell phones and addictions. I mean, we all have the addiction. The phone itself, however, is not an inherently bad device. It's the fact that the systems, the apps, frankly, and we're talking social media here, are specifically designed, as Mihir said as well, to make us crave more. That's the aspect of this that we need to think about. Not regulating types of content, not trying to censor what people can say and not say, not even, frankly, trying to determine what's true and what's not. We have to go right to the design of these systems. And the only way to do that is to put forward a new Canadian law that gives a new regulator powers to bring the companies into line and be productive members of our society. So we learned a lot from the legislative session prior, but I think some of the lessons still apply. Like, for example, this is a minority parliament, meaning with the Prime Minister's very big security and economic sovereignty agenda, it's going to be hard to get time in the House of Commons to dispose of a bill that's not listed in those top 7-ish priorities. And to make them see that this is a priority, we all have to be asking for basically the same thing. I'm just going to share in the chat here our Safer Online Spaces campaign that I mentioned earlier. It would be great if you could all share that within your personal and professional networks. The more signatures we get to the pledge, the more likely we will be to persuading them that this is something that makes a lot of policy sense to do, but also it makes good political sense to do because we've got thousands of Canadians signing up and asking for this.
Yeah, thanks, John. There's a question here. It says there are reports that the Canadian government's relationship and dialogue with major social media platforms has broken down recently, particularly as companies adopt a more hardline free speech stance and scale back content moderation in the post or the current Trump era. In this context, how can Canada meaningfully enforce platform accountability and regulations? John, did you want to go first on that?
Sure. First of all, I think we were all disturbed by the sight of Jeff Bezos, Elon Musk, Sundar Pichai of Google, and Mark Zuckerberg standing behind Donald Trump as he was inaugurated for the second time. However, I think that the so-called alliance between big tech and Trump is a bit overplayed. Trump is no fan of big tech. I mean, the U.S. Commerce Department is currently investigating big tech for alleged censorship of presumably conservative voices. They have obviously, like we all know, taken a very aggressive approach to trade relations. And anytime an American company will be regulated, like let's say Google is subject to a new law in Canada, they're going to run to the White House and basically complain. But I don't think that it's impossible for us to put forward a piece of legislation that's non-discriminatory against American companies, obviously, and actually get it passed without facing retribution. I look to the recent example of the United Kingdom, who just negotiated a new trade deal with Donald Trump, and they made no concessions on their digital services tax, a hot button issue here in Canada as well. But more importantly, for the purposes of our discussion, they made no concessions on the Online Safety Act that our bill was modeled after. So I think it's possible to get this done in the current environment. There are cleavages between Donald Trump and the big tech industry in San Francisco, in California. So I think it's possible.
Yeah, thanks.
May I just complement an answer on to that? I think it has been, of course, a challenge as well in Europe that has been brought, like the impact of tech regulation on free speech, for instance. And I would say that I mentioned the importance of human rights and children's rights, and I think that's where, I mean, Canada, with its longstanding commitments to the Charter of Rights, that's where it's so important to ground tech regulation in human rights and in children's rights. But it's about a balance, right? It's not the freedom of speech at all costs. And that's where an approach that is grounded on human rights and also on the impact of design, because we mentioned how important and how the design is amplifying this harmful content. And so putting the aspect of putting the regulation, and that's what the Digital Services Act in the EU is doing. I saw a question about asking me to come back on international regulation, but that's what the Digital Services Act is doing. And that's where also risk assessment that assess the risk of measures as well on the broader range of human rights and children's rights in this case is also very important. And then on how Canada can also push this, I think international alignment and international collaboration of regulations is also helping to make the case as well. Canada is not the first mover, and there has been many countries before Canada that has moved in this direction. And then when the law is passed, and then we see it in data protection all the time, how regulators are working together to enforce the law. And then it cross-border collaboration is even more important. So just some elements here to answer this question.
Yeah, thank you. Our next question is, and maybe Tracy, it was directed to you if you wanted to go first. After all these studies, in your opinion, what would be the appropriate age to access social media, regardless of what big tech says?
It's really tough. I mean, I'm going to say 14 just because logistically it makes a little bit more sense. High school typically starts at around 13, 14 in Canada. But one of the challenges is that there's this overlay between social media features and the developing brain. And so we are making this assumption or we're taking this age out of thin air in a sense. Like we really actually need to see what happens to the brain of a developing child and looking at different sensitivities, different periods, and whether they're more sensitive at 14 than they are at 16 to the addictive features, that sort of thing. Those studies aren't done. So there have been some people who've argued 16. There have been some that have argued 12. I'm just going to say, let's just start it. I would not, let kids be kids. And once they get into high school, this is something they could use. There's a lot of evidence coming out on the neuro side. But the problem is again, it tends to be like one age band looking at it instead of looking at it across the developing person repeatedly. And there's also some ethics attached to this. So I didn't really answer the question, but I answered it like I wanted to qualify it. I wanted you to know when I say 14, I'm saying this from a practical point of view. I'm not saying that there's like strong empirical evidence that this is exactly when it should be. And there's many things coming in, but I'm really worried about what happens to the developing brain. We know that frequent use is associated with alterations, particularly to the amygdala and the prefrontal cortex. It changes social rewards and punishments. It makes kids more sensitive to social cues, more reactive. So we know there's something going on. And so I'm just going to take a guess at 14, but we need more evidence.
Yeah, for sure. And a 13-year-old processes risk differently than a 15-year-old, than a
All
17-year-old.
of those things,
They're
yeah,
so
but it's really their brain that's driving their
yeah.
risk assessment, right? So ultimately, there's this thing happening here that we need to pay attention to, and it changes quite dramatically during the teen years. So we need to take care of their brain.
Did anybody else want to come in on sort of age-based design? Marie-Ève?
Yeah, I mean, that's of course something we're thinking a lot about. And as Tracy highlighted, like the importance of features, sometimes we're talking, oh, just social media, but we're seeing a lot of those features that are on gaming, for instance, or that are on edtech products. So instead of looking necessarily at banning certain social media, I think we would recommend a more comprehensive approach. And if there are specific features that should be addressed and that should be tackled, then I think that would be a bit of an approach that would also be more comprehensive across the board. And then, of course, the age is also at 15, you should not be maybe left also in the wild, and companies still have responsibilities to respect children's rights until 18. So what about when children are going out? There should still be risk assessment and also non-addictive design, I would say.
Cool. I'm gonna prioritize one final question here, but while I'm doing that, I'm gonna ask one more time for our participants to answer a few poll questions to help us evaluate and improve our events. And as a reminder on that, you'll have to answer all 3 questions before hitting submit. Okay, so our final question for panelists, I think, would be to sort of moving into action and the role that the child health community can play. What would be sort of a key resource or 2 or 3 that you'd want to share to sort of support action following today's event. Today's event is part 1 of a 3-part series that Children's Healthcare Canada is leading on this work. We're going to be doing a follow-up workshop on sort of what the strategy is and what is the role of the child community, and then into the fall, sort of engaging parliamentarians on this and ensuring that child voice isn't left out of the conversation. So I'm going to go in alphabetical order. John, what's one resource that you want to share with the group?
It's the Safer Online Spaces campaign. The more we can circulate that, the better. And I also have ideas for the participants as to directly communicating with the government and the certain individuals around the Prime Minister who would, I think, benefit from hearing your either clinical experience or experience directly with your own children about these harms on social media. So we can follow up after that, I think, with those names.
Marie-Ève, you're second.
Yes, maybe that will be a little bit out of scope, but that's something we will be doing in Canada. So there is the Office of the Privacy Commissioner that has been really long-standing champions on children's rights to privacy, their protection and best interests. And I mentioned the age-appropriate design code in my presentations. And just to say that it has been grounded in privacy and data protections. And building on that, so the Privacy Commissioner is launching a consultation on the Children's Privacy Code in Canada. And this builds, I think, on long-standing attempts that have failed to really do it at the regulatory level. So we will be coordinating a joint submissions. So if you're interested, I will put my address in the chat and then happy to have you on board.
Awesome. Here.
Yeah, if you all are curious about just understanding that youth perspective and impact of misinformation, disinformation in the digital space on youth, the U Report poll information results were already posted in chat. That basically details, how youth across the country are feeling about these type of issues, and it's a platform for youth to engage. So if children of your own peers, please tell them to engage with that resource as well. Their opinions are really valuable for practitioners and experts like others on this panel here to understand what youth want, their current level of understanding and education on these type of issues, and common misconceptions, what they believe. We're asking them questions to see the impact of misinformation, to see if they know the truth, if they can discern fact from fiction. So these resources, these polls, groups like UNICEF Canada have made them really accessible to youth across the country. So please share these resources with those who can benefit from it as well.
And Tracy.
So I'm not going to suggest a resource. I'm going to make us the resource. Children's Healthcare Canada is obviously motivated to improve the lives of children and their health. So I think we should all be encouraging anybody under the age of 18. I think that we should also heed this advice as adults to not use our mobile devices or any screens before we go to sleep. We should let it go at least 2 hours before we go to bed, get a good night's sleep. That will improve attention, cardiovascular health, mood, you name it. So let's get better sleep by putting the phones aside and our iPads and the like. So there, I guess I'm the resource on this, Ryan.
Perfect. And yes, we'll follow up with these resources, and I think most panelists have agreed to share their email address with participants as well. Thank you so much to our panelists for a fruitful discussion today, and thank you to the Canadian Medical Association for supporting this work. If you do have any specific questions that weren't answered today and want to discuss online harms legislation, I think my colleague Sarah is going to throw my email address in the chat. I can be reached at rvoicen@childrenshealthcarecanada.ca. We appreciate you spending the last 90 minutes with us. To view a recording of this pop-up event as well as other past pop-up events, visit our website at childrenshealthcarecanada.ca. We'll also be circulating a brief based on what was discussed today. You'll see that sort of on our website and social media accounts to help keep the conversation going. And I'm going to go back to Dr. Reimer's words. Our most complex problems deserve our curiosity, our conversation, and most of all, our action. Thank you again for joining us today, and we look forward to taking action together.